Hello everyone, welcome back to the channel. Today we are discussing about concept of pharmacokinetics, mainly distribution. For more details, check out the link in the description below. Don't forget to like and subscribe for more updates. So what is distribution? Distribution is defined as the reversible transfer of a drug between one compartment and another. For example, after taking tablet, it go to the stomach, then to the blood circulation. So tablet is equally distributed in systemic circulation. This phenomena is known as distribution of drug, means anything is equally distributed. Since the process is carried out by the circulation of blood, one of the compartment is always the blood or the plasma, and the other represents extravascular fluids and other body tissues. So it means first compartment is blood or plasma, and second compartment is the extravascular fluids or any other body tissues. In this picture we show that the drug distributed in the body, it is the first step. Then drug is metabolized. Metabolism means drug converts to hydrophilic form. Then the drug is excreted out. In that case, plasma is the first compartment. Extent and pattern of distribution of drug depend on its. What are the factors on which distribution are dependent? First is the lipid solubility. More the lipid soluble drugs are easily distributed. Second is the ionization at physiological pH. If drug is converted into ionized form in pH, then absorption rate is slow as well as distribution is also slow. Third is the extent of binding to plasma and tissue proteins. This is convert the drug in free form. More free form of drug, more the drug is easily distributed. Fourth is the presence of tissue specific transporters. In specific receptors, drugs are easily transported. Fifth is the differences in regional blood flow. More blood flow, more amount of drug are distributed. Movement of drug proceeds until an equilibrium is established between unbound drugs in plasma and the tissue fluids. Subsequently, there is a parallel decline in both due to elimination. It means free drug distributed between the plasma protein and tissue fluid, so it easily metabolized and excreted out. That's why amount of free drug is less in blood. Then bound form drug converts to free form and start their distribution. That is called parallel decline in both due to elimination. Next is the volume of distribution. It is defined as the hypothetical volume of body fluid into which a drug is dissolved or distributed. Apparent volume of distribution equals to amount of drug in the body by plasma drug concentration. V upon D, this is volume of distribution equals to X by C, where X means amount of drug in the body and C means the concentration of drug in the plasma. It means dose of drug is equally distributed in all part of the body. It is a property of drug which shows how much of drug means to be in the body to get a certain concentration in plasma. The word apparent because it is something that doesn't exist, but we have created it to understand what is the amount of drug that is distributed into various organs and tissues. So by volume of distribution we can determine the exact dose of a drug for the therapeutic effect. Steps in drug distribution. Means for distribution, what are the steps to be followed? First step is the permeation of free or unbound drug present in the blood through the capillary wall and entry into the interstitial or extracellular fluid, means ECF. And the second step is permeation of drug present in the ECF through the membrane of tissue cells and into the intracellular fluid. Next is the plasma protein binding. What is the plasma protein binding? The phenomenon of complex formation with proteins is called as protein binding of drugs. The binding of drugs to plasma protein is reversible. The extent of order of bindings to various plasma proteins. In our body, these four types of plasma proteins is present. First is albumin, second alpha-1 acid glycoprotein, then lipoprotein, then is the globulin. So, albumin is present more amount in blood. That's why drug is bind fast to the albumin. These are the example of drug which show their binding affinity to plasma protein. First is the human serum albumin. Large variety of all types of drugs, specifically acidic drugs such as barbiturates, benzodiazepines, phenytoin. It means acidic drug shows higher affinity for albumin. Second is the alpha 1 acid glycoproteins. Basic drugs such as imipramine, lidocaine, quinidine, etc. It means basic drug shows higher affinity for glycoproteins. This portion is very important for MCQ. Acidic drug shows higher affinity for albumin, A acidic, A albumin. Second is the basic drug shows higher affinity for glycoproteins. Then lipoproteins, basic lipophilic drugs like chlorpromazine. Third is the alpha 1 albumin. Steroids like corticosteroid, thyroxine, and cyanocobalamin. These are the alpha 1 globulin. For alpha 2 globulin, what are the affinities drug? Vitamins A, D, E, K. These are and cupric ions. These are the shows higher affinity for alpha 2 globulin. But cyanocobalamin, steroids like corticosteroid, and thyroxine shows higher affinity for alpha 1 globulin, and lipophilic drugs chlorpromazine shows higher affinity for lipoproteins. Lipophilic drugs, lipoproteins. Next is clinically significant implications of plasma protein binding. After drug binds to plasma protein, what are the clinical significance? First is smaller volume of distribution, bound fraction is not available for action, temporary storage of the drug, high degree of protein binding generally makes the drug long acting. Then displacement interaction, example indomethacin, phenytoin displace warfarin. Displacement means if two drugs bind to the same plasma protein, one drug blocks the binding site and second drug fastly exit out. As a result, effect of second drug is very less. So clinical significance is we cannot prescribe indomethacin with warfarin, we cannot prescribe phenytoin with warfarin. In hypoalbuminemia, binding may be reduced and high concentrations of free drug may be attained. Example phenytoin and furosemide. It means if any disease decrease albumin amount, this is called hypoalbuminemia. In that patient, phenytoin should be given in slow dose. These are the clinical significance of plasma protein.